go.
Hello, hello. It's Thursday again, and I'm Naomi, and this is Alex. We're part of the infant feeding team at the John Radcliffe Hospital in Oxford. This is our hour session, about an hour, on anything to do with infant feeding. So if you've got questions, put them down there for us, please, because we love your questions. So this is we're almost 2 years now we've been doing this for, not always every week, but as much as we can. Lots of things get in the way, but we try and be here most weeks. So this is not about scans or what to bring into hospital or place of birth or anything like that, but we've had lots more sessions recently about having babies. So wait for those forums, because we won't always know the answers because we don't work in those areas, and big period of change with the government guidelines, but I think business as usual in the hospital, so we're still practicing all the things that we've been doing throughout COVID. That hasn't changed.
Yeah, still need to be doing natural flows.
Changed.
Yeah,
that hasn't changed.
No.
So everything is the same. So hopefully you will be updated as and when, if it does change at all. But at the moment there isn't any plans. There aren't any plans to make a difference, because we have got the most vulnerable people in hospital, and so we protect everybody. So this session is about anything to do with feeding your baby. So if you're giving breast milk to your baby at the breast or in bottles, if you are giving formula, and or if you're wanting to introduce solid foods, things like that. So it's about any aspect of feeding. You don't have to have a little baby to talk to us. So yeah,
you can have a little one, you can have one in utero, or you can have two. One.
You can have one doing one and one doing the other. It doesn't matter. If you've got any questions at all, we'd be delighted to talk to you, and do put some juicy questions down for us, because we like those. And I think you had lots last week, didn't you, Alex?
I was kept busy. I was kept busy all for my full hour. Yes.
Which was really
and
fabulous.
Lots of lovely people who'd come on, and it's so nice when we get people who've been on before, or we've met in clinic and they've had a few problems and we've met you, and then you come back and tell us how things have gone. And so we've had a few recently who are 18 months and 14 months and doing a brilliant job. So
they're all sort of COVID babies.
Yeah,
they're all
Leanne
lockdown babies, aren't
they?
All of them.
Like Leanne and Imi, and there's been a whole bunch of them recently who've been done with Claire, and Claire's having another baby. That was lovely. So yes, it's been brilliant. We've had some lovely feedback. It's nice to see, and it's nice for the people who are listening to hear that you maybe had a few problems in the beginning, which is why you got involved with us, and actually you've gone on and you've managed to meet your own goals. You've achieved your own goals, whatever that goal was.
And that actually there is a light at the end of the tunnel, because I know when you are in that bubble of breastfeeding in the early days, it's quite a shock when you're tired, isn't it? When you've had a long labour, and then you have got a baby that needs feeding all day and all night, and it's nearly always all night, because that's what babies do in the early days. They chase the milk supply to increase prolactin levels. Absolutely. And they really work hard on mum's supply, and that happens to be in the dark hours, not the daytime hours. So you often find they shut their eyes at 8 o'clock in the morning, and then they wake up again at 8 o'clock at night, and you don't see their eyes all day. Yeah,
it catches you at low ebb. It's when we can cope with the least, is the middle of the night. So I often say, if you're making a decision, and actually that came up in clinic today, as we always do clinic before these sessions. And in clinic, I was chatting to one of the mums who was chatting about, making decisions. Don't make big decisions in the middle of the night. Make them in the cold light of day. Have a good think and have a discussion. I can see lots of stuff coming up. That's great.
And
it's really good.
Partners often come to us and say, "You don't understand. My partner hasn't had any sleep."
We do.
She's really tired, and actually, there's 43 women on the postnatal ward that haven't had any sleep and have had long labours, and not necessarily long labours, but they're very tired.
Yeah.
And they all come from it in a different way, but they've all got newborn babies, and I think it's because it's your first baby, or it's the first experience of what you've had as a partner. You're protecting them, and that's absolutely how it should be. Absolutely how it should be. You're doing your job, but all new mums are exhausted, absolutely exhausted, and that continues for quite a long time, doesn't it? So accept it and work with it, and sleep round the clock, and get as much help as you can. So if people say, "Can I do something for you?" Say, "Yeah, come and clean my house." Yes. Can you make me a meal? Do a bag of shopping, or here, take the ironing. Because it depends what sort of person you are, but if you're very much a lists person that likes everything in order and everything to be clean and tidy every day, it's a real shock. Alex is laughing because she's like that and I'm not.
I am. I'm giggling because I can
don't
see you.
mess.
I can see you thinking, you know, oh my word. I can remember my friends coming around going, "Gosh, this is the messiest I've ever seen your house." Yeah, I do like my house nice and tidy.
It doesn't have to be like that. Nothing will happen if there's a bit of dust.
No.
So I think, you know, it's, don't put undue pressures on yourself and look at your priorities in the early days. But if, you know, if somebody comes along and says something, can I help? Say yes, you know, put the hoover around, or yes, please do a bag of shopping, or yes, please clean the bathroom for me. You know, because if they're friends, they'll do that.
Yeah.
If they're family, they'll do that.
Yeah, absolutely.
If they're offended by anything, they're not friends, you know. So just use them, because you'll do the same for them.
I always think the best friends, the best friends are the ones who turn up with a meal. Yeah. So there was a lovely, I think I've talked about this on here before, but there was a lovely organisation down in Harwell where when a new mum had a baby, that all the other mums clubbed together and delivered a meal. It was just lovely. They would deliver a number of meals for the babies in Harwell and mums in Harwell. It was so nice.
It's a lovely thing to
do.
Yeah,
really nice. So.
And the other best bit of advice that I was given by a GP when I was very early on in my postnatal period of my first, she said, know what you're having for supper by 9 o'clock in the morning. So you get up and you think about supper when you've got the most energy, because you know, by 7 o'clock you really haven't got any energy, and that's when your partner comes home from work and you've got to start cooking and you've got a baby that starts wanting to feed all night. So you know, make food, know what you're having, make food while the day is young, put it in the fridge, and then when you're absolutely exhausted, take it out of the fridge, put it in the oven or whatever, you know, but have something in your mind that you know what you're doing, because you end up eating the wrong things if you get to 7 o'clock and you haven't, or you go to the chip shop and get a takeaway, and it costs a lot of money. So, you know, plan and think and fill your freezer up with food. That's the other thing, so that you can have food if you're breastfeeding with a fork. You know, don't do steak, because that's really difficult to eat when you're trying to hold a baby as well. So, you know, have fork food so that you can shovel it in while you're breastfeeding, and also that it doesn't land on your baby. So something quite easy that you can have.
I used to have mine here with a napkin over the two of us.
So we've all been there. We all know what it feels like to be absolutely and utterly exhausted and not knowing where to put ourselves. And I think it's just making sure that you get your priorities right when you have your newborn baby, and don't put undue pressure on yourselves to make everything perfect, because you know the world is not perfect when you have a new baby. It's chaotic, and accept it. If you're struggling with the fact that you know you don't know what's going to happen next, and that's quite hard, because some people can't cope with unpredictability. So and that's perfectly normal. But you know, just being able to cope with that is important. We got lots of questions.
We've got stuff popping up.
Well,
let's go to some of that. So Jessica has said. Hello Jessica, has said, just want to say thank you. I sent an email last week regarding having hypothyroidism and my concerns, and I was given loads of info. Thank you. So that's brilliant news. So I think Tamara spoke to you actually. So I seem to remember you called. So good news. And to anybody else that's listening, we do sort of periodically remind you, if you are in your antenatal period, you know, you haven't had your baby yet, and you've got any of the risk factors that would involve needing to talk to us, then by all means get in touch, or get in touch via your community midwife. We do antenatal telephone appointments, so they can vary in length depending on your need, and we slot them in when suits you and when suits us. I think I've got at least one tomorrow.
We're
You've got a couple on the weekend.
Moment, so if you're waiting for a call and watching
we
this,
will be
we
in
are
touch.
Working through a very, very long list, and we will get back to you. But it might be that you have very short notice for your appointment, because we're fitting people around other things. So check your junk mail if you're expecting an email from us, because sometimes the emails go into junk and you don't pick them up until it's afterwards. So you know, do check everything. But if you are waiting, we have got you on our list.
So the sort of people that we'd be talking to, and people, you know, women out there who maybe have got hypothyroidism or polycystic ovary syndrome, haven't had any breast or chest surgery, they tend to be the ones that we speak to the most. And then anyone who's got a really complex medical history and might be on a, you know, real cocktail of medications, and we'd be interested to talk to you as well. So what our plan would be to have a chat with you, find out what's happened, and also the mothers who've had a difficult experience the first time, that we think we can hopefully make it a bit better this time. Gives you a chance to have a quick chat about what happened last time. What can we put in place to make it better next time? So it's a telephone conversation about it, and we get some stuff on your computer record so that all the staff in the hospital know what we've discussed and what the plan is, and we get you to write in your notes as well to say that you're known to us, and that as long as we're in, we will come and find you when you've had your baby.
So it's appropriate, and
it may not be.
It might not be. You might not want to see us because everything's going well.
Yeah.
But I think also knowing that you can self-refer to us, that's really important, because I saw someone in clinic today and she just said, with my last baby, she had a very traumatic experience, and she said, I didn't know, they didn't refer me to you. Nobody offered to refer you, and you don't have to wait for somebody to suggest. You just pick up the phone and call us, and we can triage you and talk to you about what's the best options that you have when you talk to us. And it might not necessarily be to see us, but we might be able to put you in the direction of Oxfordshire Breastfeeding Support, or La Leche League, or NCT, the Breastfeeding Cafe in Abingdon. They're all satellite, really experienced, highly qualified lactation specialists that will support you, and it's all free. So everything is available to you in the community, and it might be that it's more appropriate that you see them than see us in a specialist clinic at the JR, which is not really very easy to get to. So you don't have to come and see us if it's something about positioning. You don't, and it's the same on the ward. You don't need to see us on the ward for positioning and things. That's the job of the midwives and the maternity support workers, and your midwives at home, and also the local breastfeeding support in the community. You don't need to see us for things like that. We see mostly on the ward, and today we haven't got anyone at the moment.
No, they haven't asked us to see anyone yet.
Because mostly the midwives deal with the problems. We only see 1 or 2 mums on a ward. We don't, in the 43, we don't see mums that are just wanting to have a chat to us usually, because the midwives can give you the advice that you need. However, if you go home and you feel that you want the support, then you can self-refer and you can call us. So don't be upset if we say we can't see you on the ward, because we have other commitments, and we feel that the midwives are qualified enough to give you the support that you need in the early days. So
they're all trained to give you breastfeeding support.
We spend, which is why we don't have time, is that we spend a lot of time training them. So we have about 600 staff that we need to train, and we do that quite frequently. An update, at least once a week, we're updating one of the factions of staff to make sure that their skills are maintained, and they've got an opportunity to talk to us if they've got any questions.
Right, move on. So so thank you for that feedback, Jessica, and that really hopefully that opens up to other people to know what we are, what services we do offer. Jodie has said, I wanted to try breastfeeding, but I'm having twins. Are there any tips for breastfeeding with twins? I feel it will probably be too overwhelming with breastfeeding and expressing for 2. We have many mothers who manage to feed 2 babies. Your body is geared up to feed 2 babies. Twins are so common in mankind that the body produces enough milk for twins as long as we ask for it. And we know many mothers who have managed to get to 6 months and exclusively breastfed their babies. Now, that's not everybody, but there are people, you can do it. But the first thing I would say to you is positive attitude. Go into it believing you can do it. Your body's carrying these 2 babies. So your body should be able to feed these 2 babies. Just get as much support as you can, and don't worry about trying to feed 2 at the same time to begin with. Get feeding going and maintain your supply. Yeah.
That's the most important thing, is that you get your milk in. So the more stimulations of your babies, they're a little bit small because they might be a bit early and a bit small if they're twins. They may be a bit sleepy, so they're not stimulating you as much as some other babies, single babies that are more mature. So do lots and lots and lots and lots of stimulations if your babies are asleep. If they're sleepy in the early days, it means that you've got lots of colostrum to give them, but also you're doing lots and lots of stimulation of your prolactin receptors in your breasts, and so it's giving the brain messages to make masses of milk. And with twins, you've got to feed twice as many, obviously, so you've got to make enough milk to feed them both. And as Alex said, most women can do that. But if you don't do the stimulation, you can't.
So it might be worth it, depending on what gestation you have your babies, it might be worth learning how to hand express before you've had them. Learning that skill, we talk about this on here very frequently, learning the skill of hand expressing prior to having your baby is great, because as we've mentioned, mums are really tired in that postnatal period, that immediate postnatal period. Trying to acquire a new skill, it's not a great time for that. So if you can learn it before you've had your babies, and then you know what you're doing, so should you need to give them additional milk, then you've got the possibility of doing that. And maybe think about, you know, sort of just maybe sounding out somebody who might like to buy you a nice present, a double pump, as a backup, you know, in case you need it. So that would be, you know, a handy thing to have as well.
And also, I know it's really simple, actually learning to use a syringe like this. One of these, it's a bit tricky. So if you pick one up and you've just had a baby and you've got a you know, drip in your hand, and you've got other things going on, and you've never picked up one of these and tried to use it before, you know, it is quite difficult. And actually, you know, what most mums do is they hold it like that. Can you see? Hold it like that so that it's across their hand, and then they pull the plunger out from that end, and they hold the syringe like that, rather than trying to use two hands and do it like that. You might find it's easier to lay it into your palm, put your thumb and your first finger around the top of it, and then pull the colostrum that way round from your nipple, so that you've got better control of it. But it's hard sometimes for mums to do that, and then they push the plunger and it goes like that, and all the colostrum you've collected comes squirting out. So it's really good to have a practice on one of these before you've got anything else to think about. So you know, it is worth it just to handle the different things, including your breasts.
Talk to your community midwives, because they should be able to help you getting some of the syringes. So if you have an opportunity to do some hand expressing, we don't do it till 37 weeks, so please don't start till 37 weeks. That's why I said it depends on the gestation of your babies. You can have a go at 36 just to get the skill, but don't do regular collections until the babies are 37. And we have a leaflet on our webpage. If you do a search on Google, go OUH maternity feeding, our webpage will come up, our infant feeding webpage, and that links to resources. And on the resources, we've got a set of 7 videos. There's a link that takes you onto YouTube, and we've got 7 videos, and there's a hand expressing video there, and it shows a mum collecting colostrum exactly the way Naomi's just explained, the way she's holding it, and you can see quite clearly how she's doing it. And we have a leaflet as well on the web page. You can link onto the web, and then it's all about collecting colostrum before you've had your baby. So that would give you an opportunity to learn the skill, and if you get beyond 37 weeks, to collect some colostrum, so you've got a little bit of a backup. But what you do afterwards is what makes the difference. So Jodie, be confident.
Change your language.
Be really confident that you can do it, because we've met so many mums who can do it, and they do a brilliant job. And if you need support, you contact us and we'll give you some support.
And it is almost, you know, it is normal having 2 babies. It is normal, and we have many sets of twins on the ward. It goes in phases. Where we have lots and lots, and then we don't see so many, but it's almost a normal thing. Whereas before it used to be a you know, real sort of, oh, we haven't had many twins, but actually we see lots of sets of twins now. And so it is within normal. You've got 2 breasts normally, and you know, everything is there to produce enough milk to feed 2. So it gets more complicated if you're having 3, but people do exclusively feed triplets. But with 2, you should be able to do it. And you know, the other thing you can do is hand express in labour. When you're waiting for your babies to come, it helps labour, hastens labour on. But also, you know, in the early phases when you're waiting for things to get going, or you're having a planned cesarean and you're waiting to go for your cesarean, you can do some hand expressing then if you're preemie. You know, so if you're before 37 weeks and you're having your baby early, and you know that you're having your baby early, and it's all planned, you can do some hand expressing then as well as practice. And then you can just put the expressed tiny bits of colostrum on the side, and they're okay for 24 hours. So you know, you don't have to worry about storing it, because it's okay at room temperature on the side of your locker or in your bag for 24 hours. So you can then give it to your baby once your baby's been born as extra, so that you're still doing hand expressing afterwards, because that's crucial. The more you stimulate, the more you ask your baby, your breast to make milk for your babies, the more you're going to make, and the more you'll have on day 3 when your milk comes in, to give your babies when they need it. So, you know, if your babies are sleepy, or you've been separated from your baby because they were premature, or they needed, you know, more support for any reason, do hand expressing. You know, we say 3 feeds in the first 24 hours for most normal healthy term babies, but actually you could do 8 stimulations in 24 hours and you would be making milk. Don't go to sleep. It's exhausting, but don't go to sleep.
Get some sleep in between.
Yeah, sleep in between, but do some hand expressing and do some stimulation if your baby's not feeding frequently.
Right, I'm going to move on. So Jodie, all the best.
Lots of
And
questions.
Charlotte's come on. Charlotte's our top fan. She says,
Nice
hi
to
ladies,
hear
hope
you,
you're
Charlotte.
okay. And she says, and you're top fan here. Yes, you are. So I said that before I'd even read it. Hope you're keeping safe and well. Alicia's asleep. She's no waving today. Can we please all pray for Ukraine? Absolutely.
Definitely.
Yeah, I agree.
Yeah.
It's very frightening what's going on at the moment. Right, Emily has said, hiya, I've been breastfeeding my daughter who is now 11 months. She doesn't seem to like formula or express milk, but does like normal blue cow's milk. She's going to nursery next week. Could I give her some cow's milk to have during the day, but continue to breastfeed at night until she's 1? She eats food really well and probably only breastfeeds 4 times during the day and about 3/4 of the time in the night. I don't know what the situation is. It's normally 12 months, isn't it, to go on to cow's milk?
12 months is she? I mean, if it's a week before, then you'd probably say yes, that's okay.
Yeah.
But if she's just 11 months, we should say really you ought to wait till 12 months because that's the guidelines. I shouldn't think she'll come to huge harm, but actually nutritionally the recommendation is just to wait another month. So, and does she take? What did you say? She doesn't take water either.
No, I shouldn't say about water. I said about
I mean,
formula or
if
express.
if she's having lots of other food and she refuses everything else, then you know, have some water and then give her more food when you give her breastfeeds when she gets home. If it's you know, she's not there for long, you know, 12 hours or something. But if she's, you know, if she's got a long stay at the nursery, then she probably does need some milk still, as it's part of her diet. But just to make sure she doesn't get dehydrated.
Lots of feeds when she's at home.
I think, you know, if you're not going back to work full time and it's only 4 weeks before, you know, four weeks at the nursery before she can go on to cow's milk, then
She's very discerning.
Very.
You can tell the difference.
And obviously, has she been having cow's milk already? And she's tolerating it, but we don't recommend that they have cow's milk at this stage. I think
it's mostly because formula milk's all fortified, isn't it? It's got all sorts of other things in it. So
make sure she has a good balanced diet if you do it. But I would, it's not something we'd recommend, but if you're doing it already and she's okay, just make sure that she is getting all the other things that she needs.
Lots of breastfeeds.
And obviously it's not sterilised like other foods and heated, so you know, it's pasteurised.
Yeah, she eats food. She eats food really well and probably only breastfeeds 4 times during the day.
Yeah, so you know, she's probably not getting huge amounts of milk in the day now, but I think it's not very long till you get to 12 months, and then it's okay to do that. But we wouldn't recommend that you give it.
Normally you hang on till the 12 months.
But if she's nearly there, then it's probably all right.
Molly has said, hi, new to these lives, so don't know if you cover specific topics on each live, but I was just wondering if there had been any update on the amount of people that are allowed during labour. Is there still one, or do you think policies will change anytime soon? We're predominantly feeding, but we do know that at this moment in time there is no move to change the visiting or, you know, birth partner situation. It is one person.
Check the website, and OMVP is normally always the first people to put up on their website. They're so on it that they put on this Facebook page about what the changes are. So you know, if you're following OMVP, you'll get that up on your link if it does change. But you can check the Oxfordshire the John Radcliffe website as well, because that's posted and changed as things happen. So the homepage for that will give you every aspect of visiting and everything else in the hospital.
But at the moment it is one person. It's definitely
we're looking after vulnerable people in hospital, so we have to protect the vulnerable, and so that's why we're keeping with everything else, that we're minimising contact with people that aren't so fortunate to be healthy.
Emily has said, also wanted to say thank you. I joined these lives when I was pregnant and you were great about reassuring me as I was worried I wouldn't be able to breastfeed, but had a really lovely and quite easy breastfeeding journey.
Lovely to
Yay!
hear. How nice.
That
That's
is
lovely and
so
positive for
nice.
everybody to hear, isn't
So
it?
that's Emily that's been feeding for 11 months. Isn't that wonderful? So, you know,
That's really, really,
really
lovely
brilliant.
feedback.
We like hearing that.
Yeah.
Sandra has said, hello, I'm 39 weeks today, no health issues. It's my first baby. Should I start extracting colostrum? If so, how often, please? So 39 weeks, yes, you can definitely have a go now. 4 times a day, have a look at the leaflet that we mentioned. So go and have a look on our website, OUH Maternity Feeding. Literally put that as in 3 separate words. Up comes up our own webpage. It's completely covered in the COVID, which we have to have on all of them. COVID banner. It does not look very attractive, but work your way down and you'll find there's a leaflet, a link to a leaflet about it that talks you all the way through it. And watch the hand expressing video that we've done with the wonderful mummy that let me film her on level 5. So that's one of our mums, and you can see her collecting. Her milk is just into transition. It's just going away from colostrum. Remember, colostrum is thick and gloopy, and remember that the first time you do it, or even the second or third time you do it, you might not get anything, but just keep going, keep practicing, and anything you get is going to be a bonus. So.
And the other thing to say, sometimes when you are hand expressing, when you've just had your baby on day 0, you quite often get a little bit more colostrum than you've been getting if you've been doing hand expressing before, and then the next day it goes down in volume, so you might find that you get more on day 0, and then when you go to hand express the next day and over that night the volumes go down and then it goes back up again. And sometimes that's because you've emptied the ducts that were, if you haven't done much hand expressing antenatally, and so the breast is, the milk ducts are being emptied, and then once they're emptied they take a little while to settle down and to get your volumes back again, and then the volumes start to increase quite quickly from day 3, so from about 48 hours to 72 hours you find that the milk starts to transition and come in, but you get tiny little bits, really, really tiny little bits.
Come on then, get it out. The stomach sizes.
Oh yeah, so now I've got to do that. So
we wouldn't be a feeding session if we didn't do stomach sizes.
We have to do this every week, but actually, your baby's tummy is tiny, and so don't be too ambitious on the amounts of food you're expecting to get out, the colostrum that you're expecting to get out, and that you don't have to fill it. And the syringes are so tiny, aren't they, that you've got there?
It's a 1 ml syringe. I mean, it's absolutely minuscule. And if you've just got, I don't know if you can see if I pull it down. This is like 0.1.5. If you got 0.1.5, 0.1, 0.2 on the first day, we'd be so happy as long as your baby got that a few times.
It's like a tablespoon of golden syrup.
Yeah.
So calorific, and it's so packed with stuff to line the baby's tummy. So baby takes the colostrum in, and as the baby poos when it's been born, the meconium comes out as they in the first sort of 48 hours they poo quite a lot of this green sticky stuff, and as that comes out the gut empties, and this colostrum is a laxative to help it empty, but also it lines the tummy, so it coats all of the inside of the baby's guts and all the little pockets and crevices in the baby's gut, and that stops any pathogens, so anything that's not very nice going in, so viruses and allergens and bacteria and all the things that we don't want babies to get into their blood system or into any other systems. It protects the baby from doing that. It protects something called leaky gut, and so if you've got allergens in your family, if you've got risk factors of any kind like diabetes or inflammatory bowel disease, or you've got allergies to certain things in your family, hay fever, that sort of thing, you're severely allergic, then that will prevent what we call this leaky gut, and it will line your baby's gut all the way down, so that every time you put a little bit of colostrum into your baby's mouth, they swallow it down, and this colostrum just coats your baby's gut and protects it from getting external pathogens that could create problems as they're growing up. And we do talk about this a lot when we do training, but actually that first hour and that first early breastfeed that you give your baby determines their health when they're 75. So and that's why, it's because it lines the baby's gut, and cuddling your baby skin to skin and giving them colostrum you get your bacteria onto your baby and your partner's bacteria onto your baby, and that's why we say limit the people that cuddle your baby and skin to skin and things like that, and feed your baby, because you don't want them to develop the bacteria from other people, because they want to develop your bacteria, your healthy bacteria, and that then protects them for life, and it determines whether they get heart disease or whether they're obese or whether they get diabetes, whether they get allergies to anything. And that's what you're doing when you're doing your skin to skin in the first hour or so, and also the early hand expressing breastfeeds that you give your baby. It's determining what your baby's life will be like and how well they'll be as adults as well. So it's crucial for long-term health, giving them this colostrum and lining their gut and protecting their gut from the pathogens that can make them develop these problems later in life. So you know, there's a reason behind all of it, and that's why we go on about it all the time, but you know, it really helps them. So these tiny bits, and if you have that skill in the early days and you know, you're confident doing your hand expressing and you're giving tiny drips of this colostrum, that's what you're doing. The other thing is you're stopping your baby from becoming jaundiced if they poo out all the meconium, because the longer the meconium sits in their gut, the more jaundiced they'll be. So the colostrum, being a laxative, gets rid of that, so the babies are much less likely to need to go under lights if they're getting lots of feeds. And there's a component in breast milk which attaches to the bilirubin, which is the yellow staining that they get under their skin, to cause jaundice, makes them poo all of that out, and it attaches to the bilirubin, and it makes them poo it all out. So this, you know, breast milk is a superfood. It really is a superfood. So it protects and it builds up immunity and protects the baby from all sorts of different things.
Brilliant.
So that was a long answer again.
So the answer, Sandra, was yes, go for it. Have a go at hand expressing. It'll
enough.
be well worth it. Yeah. Learn that skill, even if it's just to learn the skill, because hand expressing is your first aid. Should you go home from the birth environment, wherever you've had your baby, and that night your baby's really sleepy, and often babies on the first night, for instance, are very sleepy, or you go home and your baby's unsettled, you can't get them to the breast, they're really struggling, even if you've had a good breastfeed previously. Either way, you can get colostrum into a baby, so that works really well. It is your first aid. Not only is it then, you know, getting food into your baby, which is important, it is also stimulating your supply, which is also crucially important, because we talk about this on here all the time. It's really, you know, these early stimulations in this first 2-week period make all the difference to your long-term milk supply. That's when you can make the biggest difference. Once you get further and further away from the date of the birth, over the 2 weeks, it gets more and more difficult to increase your milk supply. So making the most of the time early on is really important. So Sandra, go for it, learn that skill. It's your baby's first aid, or your first aid in a way of feeding your baby.
And you don't ever get that time back, you know, once that time's gone, you can't get it back. So, you know, the early days you can't repeat. And that, I think people don't realise that, you know, they say they're too tired to do things, and actually you can't get that time back.
No.
You can't have a sleep and then do it, you've got to do it, then have a sleep. So, you know, you can't repeat that.
But it's a really good investment. A really good investment. Olga has come on, and I think we both remember Olga, just to say thank you, following your help, your initial help with feeding issues. Leo is still happily breastfeeding at 7.5 months, and we both love it. Well done, Olga.
It's a lovely thing to do, isn't it?
Yeah, so we have these, you know, these names that come through clinic and come through talking to us. It's lovely. We love hearing back and hearing how things are going. So the feedback is great, and I think it's so nice for the mums. You know, they want these, for instance, you know that we've just had Sandra, who hasn't yet had her baby. You know, these mums that are getting in touch, they've had problems previously, and there they are doing a great job. So
and loving it.
Yeah,
and I think that's, you know, it's more than food. It's always more than food. But
breastfeeding, you know, it is challenging. Many mums, we wouldn't have jobs if it wasn't challenging. I had this conversation with a mother this morning, you know, and we talked about the fact that it isn't natural. It doesn't come naturally. We learn from seeing people, and we don't see people feeding in our culture, and it is quite difficult. And you know, we were impressed, as I said, we've been in clinic this morning, and all the mothers that I saw this morning were struggling with very sore feeding, and we were working on that, just to greater or lesser degrees, hopefully improving it. And it is a case of working your way through it and getting the support that you need. And for some people, we can't help, and it might be that it is something that you don't continue doing, but we're here to support you with that too. So just so you know that we are here. We are, as I always say when I'm doing training to our staff, we are the infant feeding team. We're not the breastfeeding team. We're here to support people in whatever decision they make. Hema has said, ladies, you're amazing. If I can help in any way, let me know. I'm an antenatal provider and running free calls. Anything we can do to support at the JR. Oh, wow. Get in touch. Let us know.
Yeah, need a conversation.
Yeah, that sounds great. We always need more places to send mums with good support.
Yeah, absolutely. So, let us know.
This breastfeeding clinic does get really booked up. I think we've certainly booked up all of next week, aren't we?
We are, but you know, we're having to have some well-deserved rest, having little breaks and holidays that we're entitled to. So how dare we? But that means that our services are cut a little bit because somebody's on holiday. But they'll come back refreshed and zooming to go to help you when you need help.
Jodie's come back and said thank you for our comments earlier. Alice has come on. Hi both, hope you're well and thank you all for your help so far. We're breastfeeding still 4 months in. Brilliant, another name that we've had in clinic. I've got an appointment at the JR on Monday, been told I may not be able to bring baby too. I've been trying a bottle of expressed milk but she won't take it. Do you have any tips in case she needs a feed and I'm not with her? Ooh.
Have you spoken to where you're going?
Yes.
To confirm whether you can or can't, because normally they will accommodate you, and you know the policy in this hospital is that mothers and babies are kept together.
Yeah, perhaps, you know.
So perhaps have a conversation with where you're going before then.
And I'm working tomorrow, so give me a shout.
Yeah, we can have that chat.
We can have a look and see what can be done. I mean, it's very difficult when you have a breastfed baby that won't take a bottle. So very, very difficult in that situation. And obviously, you know, you haven't left her before from the sounds of it. So yeah, have a chat, give us a call and we'll have a chat about where you're going and just see if there's anything we can do to support you. Can't promise, but we can try. Yeah. Molly has said thank you for the comments, and Sandra came back with thank you. And that's it for the moment. So we've done all that. Then we got through lots there. Fantastic.
Some brilliant questions.
Yeah, absolutely.
So I think you know, we were talking today about what we should have a talk about, and I think we've talked a little bit about it. But actually, I think the biggest thing that our biggest problem for clinics and for seeing mums and talking to them on the phone over sore nipples, which you know is something that happens a lot, obviously, because it's a skill that you've got to get used to, but is milk production. And we have talked about it a little bit, haven't we, just now? But you know, we can't really say it too many times. You know, the fact that if you don't do that stimulation, if you don't get your orders in the early days, you will struggle with milk production predominantly, and it's not just occasionally. You know, if you don't ask, you don't get.
This might be worth getting the stomach sizes out again, because I think that really exemplifies how quickly your milk supply needs to go up, and it doesn't just happen. So our mothers who choose not to breastfeed, within 24 to 48 hours of their milk coming in, are comfortable. So that shows you've got to ask for the milk. You can't just expect it to happen. It doesn't just occur. Yes, your milk comes in, but if you're not removing it, you're not going to have a milk supply. And this is how quickly it needs to change. So we've got our tiny weenie marble at the beginning. This one's day 3. I'm going to put that one down. This one's day 3. You can see the difference already. This is at least twice the size. And then day 3 to the end of sort of getting sort of a couple of weeks now, you can see a huge difference. So in the same way that your baby's tummy grows, your milk supply has to follow it. So you have to keep asking. So if your baby's not waking up for a feed because maybe they're jaundiced or they're a bit premature, you have to make up for it and keep it going, because your body needs to be told to make the milk. And we say it's time sensitive. That early period, this under 2 weeks, is when it's literally keep clicking, and it will tick out until you get to the point where you can't change your milk supply. Those on you know, these mummies that have been saying hello and they're still feeding their babies many of them have been through this. It's what we deal with a lot, and it's establishing. So those that are, you know, not had their babies yet, you know, we have mummy at 39 weeks, and you know, it's thinking about having always in the back of your head, I've got to establish my milk supply. Establishing the milk supply is that early period. We can persuade babies to breastfeed afterwards. Only on the odd occasion can we not get babies to breastfeed. We've got tricks up our sleeves to help babies learn how to breastfeed. They've got brains that can cope with it and they'll learn how to breastfeed. But we can't change your milk
haven't got
supply.
milk, it's just so tragic for you,
Yeah.
you know. And I think that the other thing that we hear a lot of when mums come back to us is, nobody told me I had to do it, and nobody told me I had to feed my baby. And you know, you've got to remember that it's your responsibility to feed your baby, and we expect you as a mother to feed your baby frequently. And if your baby sleeps, you should wake it up, because you know, if you had a little puppy or a little kitten, or you know, you had a litter, mummy would be feeding them, you know, all night long. They're busy, feeding. And our mum or babies are no different. They need to feed little and often, all the time. So, and the other thing is that the other comments that we get is, nobody came to help me. But if you don't ask for the help, because there's 43 babies and mums on the ward,
often more than 43 babies, because we've got twins.
Yeah,
you
sometimes
know.
more than
we
that.
might have
you know,
46,
we don't always have the
40.
beds are all full, but nearly always at the moment we're full capacity. And you know, we're going round, or the staff on the ward are going round, and they're supporting as mums ask for it. But if you don't ask, we don't know you need help. And so you have got to ask for help. And it doesn't matter if you ask for help, that's what we're here for. You know, we'd all be out of a job without you. So, you know, we expect you to call us and ask for help. But in the meantime, you know, when you are pregnant and waiting to have your baby, when you get to 36 weeks, you should get this off to the best start leaflet from the scan department. And everybody should be getting a 36-week scan. And if you don't get offered one, make sure you ask for somebody to give you this, because it's got every single answer that you need to know about breastfeeding practically, and it's such an interesting read. And read it before you get to having your baby, and then you know where the bits are if you want to go back and explore them once you've had your baby. But this will give you so much information, and you know, it talks about poos changing, so different colours of poo, and it talks about how to store milk. It teaches you how to hand express, so you've got how to hand express on there, and as well as the videos that we've got. And it does have some pictures on positioning as well, plus all the things that you know, you will gain from breastfeeding as a mother, and what your baby will gain from getting breast milk as a baby. So you're all sent home with one of these, but often, because you go home and you're so overwhelmed with everything, you don't even know it's in your pack when you go home. But you get the opportunity to have one of these twice in your pregnancy and postnatally. So you get that information, and that tells you your baby needs 8 feeds in 24 hours. So if your baby's not having that past the first day, you really should be waking your baby up and feeding it. You shouldn't be told that you have to feed your baby. That is your responsibility as a mum, that you wake your baby up and feed it, and that's day and night. You don't just leave them for 12 hours, because that's an awful lot of food. That's 3 or 4 feeds that your baby has missed out on. And then what happens is, when you have your baby weighed on day 5, they've lost more than a certain percentage of weight, and they have to come back into hospital. They lose weight because they're not feeding enough, but also you haven't put the order in and asked in the early days to make more milk. So on day 5 your milk hasn't appeared because you haven't asked it to come in the same way. So, you know, it's this going back to, you haven't got time to sleep almost. You've got to really be busy.
Don't put people off. Really negative. You can fit your sleeping in round it.
You can, but we know that breastfeeding mums get more sleep than mums than mums that bottle feed, because they don't have to get up and do stuff. So, you know, really have a think about your plan and what you envisage your, you know, if you haven't had your baby, what your day will be like, and split the clock up into bits. You know, think about when you eat and how often that you put things in your mouth. Your baby will need to do the same. And it might be boredom, you know, it might be comfort, it might be hunger, just like you have all the little
discomfort.
Food. Discomfort,
All sorts of
you know,
reasons.
they're adapting to their world outside of your tummy.
They just want to know you're there. Rebecca's put a really good question up. She says, not that any of the mums were not, but this is very valid. She's put, first time mum, currently at 19 weeks, could you explain why we collect colostrum before birth? I thought you just feed the baby from birth and they get the colostrum then. Thank you, Rebecca. It's only because sometimes we have babies that are born prematurely, or maybe the mother has got diabetes, which puts them at increased risk of dropping their sugars, their blood sugars, or maybe that baby's had a bit of a traumatic birth, or if the baby's a bit small, we have small for gestational age babies. Why else do we do it?
If anticipated problems
Yeah.
afterwards, or if you've got medical problems, you
Yeah.
know.
So if there's any reason, then we would be recommending, for instance, our mothers who come to the diabetic clinic, it is recommended to them that they hand express. But they learn at 36 weeks and they start from 37, because the likelihood of their babies maybe needing a bit of additional milk once the baby is born to maintain their blood sugars in the first 24 to 48 hours is quite high. And it's much better if it's colostrum, because colostrum is absolutely designed for it to raise the blood sugars. So if it can be maternal colostrum, that's the best thing it can be. So that's why those mothers are taught. There is no need for you to do it if there are no risk factors, but if there are risk factors, then it's a really good thing to be able to do and to learn before you have your baby. So if you're midwifery-led care, Rebecca, and everything is going just fine, then there's no reason for you to have to do it. What some mothers love doing is actually learning that skill when they've got the brain capacity to do so. So learning how to do it. They don't have to collect, just learn the skill, see that they can get colostrum off, and then they don't have to do anymore. And then if they need to, they know what they're doing when the baby comes. So there's no obligation, there's no need, unless you've got a risk factor, I think, Rebecca. So hopefully that explains why we talk about it. But as you can imagine, we have a skewed view, because we deal with all the mothers that are having problems, which is why we're saying, we're trying to preempt that those mothers that have problems, we've already put in the parachute, we've put in the safety net to try and stop them having a problem, to make the problem any worse. So we're trying to give them the tools in order to have a better experience.
We find that most mums that come back in with problems feeding have had interventionist labour, or they've had a cesarean, or long forceps with a forceps delivery, long labour with forceps delivery, where they may have had a blood transfusion or something like that. These are the mums that we tend to see coming back. The mums that we see having home births tend to have done a lot of skin to skin and have uninterrupted feeds.
And on maternity units and everything, isn't it? So our midwifery-led units.
If you're put on the back foot if you have a cesarean, because you often feel too shaky, you feel sick, you might be cold, you might be uncomfortable, you're numb quite high up when you have an epidural spinal, when you have a cesarean, and so you feel a bit wobbly, you don't feel that you can hold your baby well, but also you sometimes feel a bit sick because you've got quite low blood pressure, and just the people rummaging around inside your tummy is quite a strange feeling. And so it's not always because you don't do skin to skin, because we don't do it for you. We encourage you to have skin to skin when you have your baby, but you don't feel that you can do it. And so we say do it as soon as you can after you've had your baby. So that might be, once you've been moved from the labour, from the delivery suite, from the operating theatre, and you're into a bed in another area where they're recovering you, do it then. When you've got a bit of a wider bed, you're a bit more comfortable, you've got more pain relief on board, and you are not quite so stressed by what's going on in the environment that you're in, because it's quite clattery and busy and people are around and distracting. So if you can, do it as soon as you can, but we know that the more skin to skin you do at birth, the more milk you will produce. And so if you don't have a lot of skin to skin for whatever reason, and you have got time to catch up in those early days, but you have to catch up in those early days and do as much as you can, and do stimulations as much as you can. So if your baby has had a breastfeed and then goes to sleep and everything's okay, then you can do some hand expressing as well, and that will chase it to really secure your supply. So if you know you're having a cesarean, or if you're slightly high risk, then think about the skill of knowing how to hand express, so that you know what to do immediately when you've had your baby, so that you can then protect your milk supply. And that's what we mean by protecting it, that you're chasing it, you're making sure that you get those stimulations in early, so that when you get to day 5, your baby's got milk, and they haven't lost too much weight, and they're peeing and pooing normally, and they're not too jaundiced. some babies will become jaundiced. We know that a percentage of babies become jaundiced, but if they are dehydrated, they're more likely to become more jaundiced. So if you've not stimulated breast, if your babies aren't attaching at the breast well, if they're not getting very much food, you're struggling. These are the babies that tend to be the ones that have jaundice. They don't poo very much because they're not getting very much food, and they come back into hospital because of the weight loss. And there's a very good guide actually on your care plan. So when you go home, you'll get one of these booklets, and it's got all the numbers of your midwives on the front, so whichever group you're in, and the support. But also it has got a page here which is really useful. It's what we call reliable signs of milk transfer. So the top bit here, and this is for you to look at as much as the staff.
Yeah.
The staff will do it, but we expect you to look at it as well. So pick it up and look at it. Don't leave it in the
Plastic wallet.
plastic wallet, and don't look at it, because
Take it out.
that will also be with it. So they're all in the plastic wallet together when you go home. But this has got tick boxes on it, and the questions that they ask you. So the first 72 hours, so baby 0 to 72 hours of age, what's the urine output, and it talks about how many times your baby pees, and if it's green in the green box, then you tick that and everything's fine. But if it says reduced urine output and you tick the yellow box, then that's a risk factor, and that you might suggest that your baby's not getting enough. And then it talks about stools, so poo.
Let's neglect these ones.
Yeah, good idea.
Here's
So
the
it
other
talks
one.
about pooing and baby's well-being, so they settled. And Alex will show you the different poos in a
Yeah, I'm
moment.
just
And then
looking for the
feeding,
third
it
one.
talks about how your baby's feeding, and the hours of darkness is essential for adequate milk production. So that means you feed 24 hours a day. You don't let your baby sleep at night. So 25 to 48 hours feeding more frequently. So if your baby is not settled and you're concerned, then you call somebody and you tick the yellow box. So you tick that side, not the green side. And then suckling pattern, so it talks about the way that your baby suckles, and are they doing nice glugs? Because if they're chomp, 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 they're not going to be getting what we call nutritive food. So they're not getting food that is making them gain weight and stimulate the milk supply. Baby should be suckling and swallowing and pausing. The length of the feed should be between 5 and 40 minutes. And so if your baby is not feeding for very long at all, i.e. less than 5 minutes, and more than 40 minutes, then perhaps you need to talk to somebody about your feeding. Baby comes off the breast on its own, and or you have to take baby off after that time because it's not finished. You offer the second breast, so your baby may have the other side. If you restrict it to one side only, it might be that your baby's not getting enough food. Are your nipples squashed when your baby comes off, or are they a normal shape? Because that's significant. The baby's not on the breast deeply enough. Are you sore? And have you used any artificial teats? Are you giving bottles? And that would indicate that if you're having to give bottles, that your baby's not able to breastfeed well, and you may have reduced supply. So the questions are all there. You can read it yourself, because it's probably a bit difficult hearing me read it. But
Yeah.
if it's green, then that's good. If it's on this side, yellow or amber, then you should be calling your midwife. You don't wait for your midwife to come 2 days later. If this is going on when your midwife is not due a visit that day or the next day, you should be calling them and asking for help. And your midwife's numbers are on the front here, so whichever area you're in, the midwife's numbers should be there, that you can call them and leave a message if they don't answer, but make sure you talk to somebody. And so you can do that, this one up to 72 hours, and then after that you do 72 hours up to 5 days. That will give you more answers as well, so that it changes. And the other thing is that the volumes we give go up, don't they?
Yeah.
And so you can talk about poos, can't you, if they don't go up?
Yeah, so, well, I couldn't find the other one in between. I couldn't find it in there, so I've just had a look. So, Naomi mentioned about the poos, and we talk about 4 reliable signs of milk transfer. The first reliable sign is that when a baby's on the breast, that you watch them go on and they put in the request for the milk. They go quick, 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 quick. And then they pause. And then they go into long, deep sucks with pauses. Long, deep sucks with pauses, and it might be 1 suck, 1 swallow, 2 sucks, 1 swallow. But if they do 4 and 5 and 6 sucks to a swallow, then we're a bit concerned that baby may not be getting quite so much food. It's much less obvious with colostrum, which is tiny weeny amounts, as we mentioned. This is much more obvious when the milk starts to come in. But the other thing we're looking at is, so that's number 1, and you obviously, once that baby goes into the long deep sucks and you can hear the swallowing, you know that baby's getting milk. Number 2 is going to be your poos and wees. So poos, well, it's number 2 and 3 in fact. So poos, when the baby's born, we've already mentioned it, they do meconium poos, and they are black like this, black and sticky and really difficult to get off the bottom. They are, I mean, it's a bit of a joke that we say to you, please use cotton wool and water, because the cotton wool and water just slides all over it. But yeah, I mean, use a nappy, take the majority off and then clean them down with cotton wool and water. But it is sticky stuff, and this is where all that stuff is, the bilirubin, that makes them jaundice. That's why it's so important we get food into the baby, and that gets the bilirubin out of the baby. They literally poo it out. So that's what we're looking at in the first day or so. And then we should go into, and we don't know where it's gone, we should go into green. So imagine this is green, there'll be green stools. Now that's going to be days 2 and 3. So this would be 1 and 2, into 2 and 3 is going to be green. Now this is much easier to get off the bottom. And I often say to parents, they'll say to me, oh, it's still black, so you can see on here.
That's your meconium, that's your green.
Mums and dads will say, oh, it's still black, or it's really dark brown. And I say, but is it easier to get off the bottom with cotton wool and water? If the answer to that is yes, we're interchanging stools. So that's really good news. And day 4, we should be opening that nappy up, and we should be seeing yellow. So chicken korma, as a couple said to me the other day, oh, just put me off chicken korma. So nice yellowy colour. Might have little flecks in it. It can be anywhere from a £2 coin size to filling the nappy, but we're looking for chicken korma yellow poos. So it could look a bit like whole grain mustard. We want a minimum of 2 from day 4 onwards. So it goes from the black for the first day or so, into green for the next couple of days. Day 4 we want yellow. If you're at home and you're looking at your baby's poos and they are not yellow on day 4, phone your midwife up please. Get hand expressing, get milk into your baby, because the likelihood is that your baby is not getting quite enough food. Yeah. Alongside all of this is the wheeze. So you think about what day are you on. So that the baby's just been born, we're going to expect maybe 1 or 2 wheeze. The next day 2 to 3. It's going to go up 1 a day till we get to day 6, when we want 6 heavy wet nappies. So that if you took the nappy off and held it and took 1 straight from the packet, you go, yeah, I can feel that, that's heavier. Yeah, I can feel the difference. If you can't feel it, go and put 2 tablespoons of water in the clean nappy and compare. And that's what we're looking for. So from day 4 onwards, we want yellow stools, minimum of 2, £2 coin. And from day 6 onwards, we want 6 heavy wet nappies. The stooling should carry on like that. Poos should carry on, yellow poos, right up to 6 weeks. And at 6 weeks, many babies will then start to stretch out the time between poos. And breastfed babies don't always poo every day after 6 weeks, but up to 6 weeks they really should. No exceptions. They should be pooing on a daily basis.
If it doesn't come out, it hasn't gone in.
Exactly. Bowels not open, as we say to our staff, bowels not open mean weight loss. So if the baby is not pooing, and particularly in those first few days, if your baby is not pooing, they are not constipated, because that does not happen, they are not getting enough food. So it is such a good indicator. Naomi picked up the Off to the Best Start leaflet, page 17 in there. It's absolutely brilliant. For those of you that haven't yet got it, the Off to the Best Start leaflet is available online. You can find it on the UNICEF website, UNICEF Baby Friendly, and it's got a PDF copy.
Well,
yeah, we've got it on our website
got it on
too.
Our page, so it's in a PDF as well, so you can
it's
see
really
it.
handy.
If you haven't got one to hand, you can see it. But you know, we know that babies that don't wee much and don't poo between days 3 and 5 will have lost more than 10% on day 5, and you know, then that causes such concern for parents, and they go down that route of having to pump and top the baby up and worry about production, and then you start worrying about volumes, because you're seeing bottles of milk and volumes that we talk about rather than tummy sizes, which is what we should be doing. You know, we're giving large volumes to catch up, and then you become you know, really stressed by that as parents, and babies drop those much more quickly than parents do. So you know, once we've started on that topping up route, it's really hard to give them up because you don't trust that your breasts are going to give enough food to your baby. So, to stop that happening, look at the signs before, and I always talk about putting the sandbags out before the tsunami. Don't put them out after the tsunami because it doesn't help. So we try and stop all of the flooding before it comes, and that makes life a lot easier for you, and it just stops all of those stressful things that you have to go through in order to catch up. And the further you are away from your baby's birthday, the harder it is to catch up with milk production. So if you come to us at 3 weeks with low supply, it's quite hard to make that up, and it involves an awful lot of hard work. So if you think it's not going well, pick up your phone, talk to somebody, go to Oxfordshire Breastfeeding Support, go to the Breastfeeding Cafe in Abingdon, call us if you need to. But your midwives and your health visitors are really good resources to support you locally
midwives
in the area that you live in. So you're not having to travel. You should be having pyjama days in the early days. You shouldn't be having to come out and travel miles and miles to get help, because your local area will have your midwives that can support you. So even though she says we'll see you on day 5, on day 2, because things are going okay that day, it may not be that night things don't go so well. So you pick up the phone and say, I would like a visit today, please, and ask for somebody to come and help you.
And they'll do the best they can.
Yeah, and if they're concerned, they'll call us. We get a lot of calls from the community midwives, don't we?
We do.
Have you got any more questions?
No, that's it. So we're going to say our goodbyes and say thank you very much. We've got 2 weeks off now, and then it should settle down a bit after that. We won't be having quite as much break. We'll have taken all our annual leave. So there is a service even when we are on, we take it in turns who's off. So, and within the team we don't all do Facebook Live. So just be aware that the team's still running even if Facebook Live's not on. So we'll see any of you in a couple of weeks' time, and good luck to those that are due babies. I think there was one due at 30, one was at 39. So Sandra is 39 weeks. She'll have had your baby. You could be asking questions then, but if you have problems, you don't need to wait for us to be back. You can obviously contact the team. Thank you very much.
Numbers are all here as well,
and our numbers in there as well. We're on the feeding page.
We're on this page. This is just for your knowledge. You won't remember if you haven't got it, but our number's just here.
Yeah.
So if you're in hospital, take a photograph of it and put it in your phone, and at home in the early days. So when you give this back, which you do eventually, you give it back to your community midwife, so you've still got our number.
We can find it on our website as well.
Yeah.
So thank you very much to all of you for your questions. Thank you very much for the feedback from those fabulous mummies who we've supported as well. And good luck to those who yet haven't had their babies. And I think it's great Rebecca's on here at 19 weeks already. She's accumulating information.
Absolutely. You'll get fed up of us saying the same thing.
Yeah, you will if you listen to them all.
But it'll go in, won't it? Anyway, we'll speak to you soon.
In a few weeks.
Bye.